Thank you all for being here today and for inviting me to speak. Doctor visits share a rhythm that you are all probably very familiar with. I knock on the exam room door, wash my hands, and greet everyone in the room. In our clinic, we start by asking how the family is, not just the child. As a pediatrician, people often assume that my job consists of treating childhood illnesses like asthma and ear infections and providing immunizations. And while this is true, it is also my job to understand and support the true determinants of that child's health. Health and illness are not things that simply happen. The well-being of the child in front of me is intertwined, dependent on the neighborhood where they live, the food they have to eat, and the physical and mental health of their parents. The health of the family is the health of the child, and so I start my visits by asking how the family is. At the Harborview Pediatric Clinic, we serve families that face many challenges. By building trust over years as a child's doctor, I have the rare privilege of getting to hear about the home lives of my patients. I hear the most intimate details of a family's life, including the joys and struggles of parenting, one clinic visit and one conversation at a time. I have heard remarkable stories from families facing adversity, stories of incredible perseverance and strength, and I'd like to share a few with you. The first story is a family of 3 young little children. The youngest is just starting to babble. The second oldest is learning how to walk as his mom holds his hand. And the third is singing songs she learned in preschool. This family is learning how to adapt to their life in Seattle. They were forced to leave their home, support system, give up their job and way of life because of war and violence in their home country. They spent several years in a refugee camp before coming to the United States. The father is now working 2 jobs, and the mother is learning English. This family knows how to endure hardship, navigate systems, and fight for their children to be safe and well cared for. The second is a story of a teenage mother. Her baby boy is instantly consoled when she holds him close, whispering his name, gently rocking him to sleep. She is determined to create a better childhood for her newborn than the one she had herself. A survivor of abuse, she is doing her very best to parent as she struggles with substance use disorder and depression. And she is doing a fantastic job. She seems to understand that it is her responsive relationship with her son that will break the cycle of trauma. The third story is of a father and his daughter. The young girl has multiple serious medical conditions, and so I know them very well. This father is committed to getting his daughter to elementary school on time, every day, clean clothes and homework complete. It has recently become harder for them to do so after losing his job and having to move into a homeless shelter. But the girl's teachers and her friends would never know. Her clothes are spotless, her hair is brushed, her science project is done. This is the population we serve at Harborview. These are the obstacles families in our community face when trying to give their children what every child deserves. These stories are shared with me in different languages and in the context of cultural backgrounds very different than my own. At Harborview, more than 50 different languages are spoken by our patients, and so these intimate conversations are often in Somali, Spanish, Oromo, Vietnamese, via a phone interpreter. But the humanity of these stories is the same across culture and language. And what I have come to understand from taking care of many families from all over the world is that parents want the same things for their kids: nutritious food, a safe, warm place to live, schools where their children can learn, and physical health. And parents who have endured significant trauma want to make sure that their children don't ever experience the same. Many of you in this room have your own stories of raising children, and you know how challenging it can be to navigate the healthcare educational systems, to get these very same things for your own children. Now add to these challenges dependency on public transportation from South King County to Seattle, 2 hourly jobs that don't let you miss work to attend your child's appointments, school application forms in a language you do not read or write, and cell phone minutes that run out before the end of the month. The stress of raising a child under these circumstances may sound unthinkable. These families need our support, and that support goes beyond providing a service like healthcare in isolation. It requires bold thinking and collaboration. These families deserve nothing less than systemic change that truly serves them. And that is where Childhaven and Harborview meet. Our organizations both understand the barriers families face, what parents need and want for their children, and the programs that make a difference. Programs like home visiting, early intervention, and preschool that support families during the critical early years of childhood and are known to make a lifelong impact. But if our organizations continue to work in isolation, many families who need the services the most will miss out. Despite focusing on connection to early childhood programs like Head Start and ECAP at Harborview, only 14% of the children we referred to these programs were successfully enrolled. With funding from King County's Best Starts for Kids initiative, Childhaven and Harborview are going to change that number. And more importantly, what it feels like to be a family served by our organizations. Together, we have started a Family Navigator program that began 2 weeks ago. The 2 Childhaven Family Navigators, Fernanda Martinez Novoa, who is bilingual in Spanish, and Farhio Hussein, who is bilingual in Somali, are fully integrated into clinical care at Harborview. Our clinic's ability to identify the needs of a family and meaningfully connect them to services will look quite different in a really good way. Now, a Somali mother receiving care at Harborview will meet with Farhio during her pregnancy. Farhio speaks Somali and can ensure that this mother is met on her level in her language within the context of her culture and that her hopes for her child are always respected. From birth until the child enters kindergarten, Farhio will be there as part of our healthcare team, focusing on early childhood, including responsive caregiver, and ensuring that families understand how everyday activities like reading, singing, and interactive play foster their child's development. The navigator will also help us identify developmental delay, behavioral concerns, or stressors at home, like not having enough food or postpartum depression. If concerns are identified, we'll be able to refer the family to community-based resources, including Childhaven. Farhio will help the parent understand the benefits of the program, complete the paperwork, find a bus route, whatever it takes to ensure the family can actually connect to the program. So those obstacles we talked about earlier, like transportation, language barriers, and others, are not the deciding factor on whether or not that child has access to the services they need. And then the child gets to go to preschool, or a therapist comes to their home to work with them on the newly identified speech delay. The foundation of this program is the partnership between Childhaven and Harborview and the trusting relationship between the family navigator and the family. Without this program, we know that the families who need services the most will never actually access them. Thousands of families in our community today don't have the benefit of programs like this. They aren't getting access to the services they need, especially families who are low income or speak a language other than English. I would like to return to the story I shared of the family with 3 young children who I cared for before our Family Navigator program began. As I shared, the family is now thriving, but it was not easy. The very beginning of their child's lives were spent enduring war and violence in a refugee camp. When this family arrived in the U.S., their fight to care for their children unfortunately did not end. The web of organizations that did not communicate with one another forced this mother to tell and retell their traumatic history. Cumbersome application forms in English that they could not complete on their own resulted in this family not receiving the basic resources they needed. Waiting lists for critical services led to delays in care. Unsafe housing forced them to move. It took over 2 years for this family to get the basic needs for their children. Now imagine how this story might look different if I was meeting this family for the first time later this afternoon in clinic. I could introduce them to one of our family navigators who would be there to support this family over time, helping to overcome barriers and access the services they needed. Childhaven has made this possible for families at Harborview. I ask that each of you join me in supporting Childhaven to change this for many more families in our community, through partnerships not just with Harborview, but with organizations throughout our city and state, and through growth with expanding their services. Childhaven is leading our community in how to best serve children and families. They are meeting the individualized needs of each family through their continuum of care model. They are breaking down barriers by forming critical partnerships, and they are growing to meet the increasing needs of our community with rising homelessness and behavioral health disorders, including opioid use disorders. And they are maintaining their commitment to build on the existing strengths of families and form relationships over time. It is undoubtedly the relationships between the therapists, case managers like Erin, teachers, parents, and the child that are the essence and meaning of this work. As a pediatrician, a Childhaven board member, and as a person in this community, I am deeply grateful for the work Childhaven does to support the families we in this room all care about, and for not shying away from the hard, messy work of partnership and growth to reach more children and families. I am also grateful to the families who trust me with their stories and their children's health. We planned and tried very hard to have a parent with me here today to share their own story and their own voice, but they were busy with their own job schedules and school and medical appointments. And so I hope, as their pediatrician, that I did justice in sharing their voice and stories with all of you today. Thank you.